The US government officially shut down on October 1st, 2025 because Congress couldn't pass funding. And while politicians fight, public health is paying the price. Our health is all in the crossfires. Here's what that looks like in real time. CDC staff are furloughed, outbreak tracking slows, WIC funds are running out in weeks. Families that use SNAP are worried about next month's benefits. And all of this is happening while flu season ramps up, measles surges to 3 decade highs, and COVID continues circulating. So, what does the shutdown really mean for health? Let's break it down. Hey everyone, Omari Richins here, founder and CEO of the Public Health Millennial, where we help you learn, navigate, and transform your public health journey. Be sure to hit that like button, hit that subscribe button, join our email list, and follow along. When the government shuts down, federal agencies divide staff into accepted and non accepted. Accepted workers keep working, often without pay. Non accepted are furloughed. At HHS, about 41% of staff are furloughed. At the CDC, it's even worse. About two-thirds of workers are sidelined. That means fewer labs processing samples, fewer disease detectives watching outbreaks, fewer staff pushing out timely public health guidance. WIC, which helps 6 million women and children access healthy food, has only a small pool of contingency funds left. Analysts say that it'll run out in weeks, maybe a week or two, if Congress doesn't act. Families already report confusion at the checkout line. SNAP or food stamps is better insulated in the short term, thankfully. October benefits are funded, but if the shutdown drags on, November and beyond could be at risk. And even before this, SNAP Ed, the program that taught families how to stretch those dollars into healthy meals, supported school gardens, and ran nutrition classes, was cut in September. That loss will be felt long after the shutdown ends. Meanwhile, Medicare and Medicaid benefits continue because they're mandatory spending. But to critical oversight, quality checks, and enrollment work may just slow down. And the shutdown couldn't come at a worse moment in time. Flu cases are rising sharply as we head into the fall and colder months. Measles cases have reached the highest number in over 30 years, more than 1,500 cases this year, with some deaths reported. Whooping cough is spreading in pockets across the states, and COVID is still circulating, even if the agency has faded. Normally, the CDC and state health departments would be on high alert, running full surveillance, communicating clearly, and supporting local response to these issues. But furloughs slow this down. It means spotting trends later, responding slower, and ultimately more people getting sick. Diseases don't take a break because Congress does. Let's talk about the workforce. Public health workers have been through 5 exhausting years: pandemic response, opioid crisis, climate related disasters. Many are burnt out, many left the field, and many may just leave now. Now, shutdowns tell them their jobs are non essential. Imagine being a disease tracker or maternal health specialist and being told your role doesn't matter enough to keep it funded. That crushes your morale. It pushes talent out of the field, and it weakens the pipeline or pathway of people who want to do this work in public health, this work that is so important to ensuring that our communities are healthy and whole. And remember, when the workforce shrinks, communities lose the people they trust most: the nurse who runs your vaccine clinic, the epidemiologist cut. And remember, when the workforce shrinks, communities lose the people they trust the most: the nurse who runs your vaccine clinic at the community center, the epidemiologist watching for outbreaks, the inspector checking water safety. Shutdowns also create a communication vacuum. When agencies like the CDC or FDA aren't staffed fully, fewer messages go out, and misinformation fills the gap instantly. We saw this during the COVID-19. Confusion breeds distrust, and distrust feeds bad actors. Meanwhile, local health departments are operating on shrinking budgets. They're asked to do more: outbreak control, health education, community engagement, with less and less every year. And the shutdown only amplifies this strain. And where do shutdowns hit the hardest? It's where the safety net is already thin. It's in the communities that are already disproportionately affected by these issues. The families on SNAP. October benefits are okay, but uncertainty looms. The loss of SNAP Ed means fewer tools to actually make healthy foods affordable and accessible for so many Americans. WIC moms and babies, just weeks away from losing support if Congress doesn't act. This would be a tragedy. How are the kids? We need to ensure that the kids are well. And that means funding programs like WIC. Safety net hospitals. They're facing tighter budgets and more patients as families lose confidence in programs. And immigrant families. Many are now afraid to even use the services that exist, like going to the doctor. With ICE enforcement considered essential, operations continue during a shutdown. And recent changes have weakened protections at clinics and hospitals, leaving people worried that enrolling in Medicaid or showing up for care could expose them to immigration enforcement and risk them being taken away from their families. That fear keeps people at home. It keeps conditions untreated. Kids miss vaccines. Parents avoid clinics. Families are suffering in silence. Equity gaps don't just widen during shutdowns, they're carved deeper. And we must ensure that these communities have a voice, have a say, have a part to play in this country. So here's the bottom line. A government shutdown doesn't just close offices. It pauses protections that keep us healthy and whole. Outbreaks don't wait. Misinformation spreads. Families lose food and nutrition support. And immigrant communities suffer in silence. All while public health workforce cut. All while the public health workforce gets weaker and strained. And the longer this goes on, the more damage that lingers. Public health doesn't stop for politics, but politics can't stop public health, unfortunately. If this matters to you, share this video, drop what you're seeing in your community in the comments, and subscribe for more. Because public health isn't optional. And until we treat it like it's essential, we'll keep paying the price. Our communities will keep paying the price. So please talk to someone, engage in conversation. We need to start somewhere because this is not okay. And we have to ensure that our communities are okay. This is Omari. I hope that you all are well. Take time for yourselves. Take time for your friends and your family and your loved ones. Do things that fill your cup. I will see you all next week. Any suggestions on topics, put them below. Subscribe, like, all those things. Join the community. See you all next week. Peace, everyone.